Hi everyone, my name is Brianna Fogelman Medley. I am a registered nurse at Johns Hopkins Hospital. I graduated in May 2020 from Delaware, Wesley College, and I just wanted to give you guys a special background and insight on why Johns Hopkins is so important to me and why working there as a nurse is so important to me. When I was 19 years old, I was diagnosed with hypersensitivity pneumonitis. My body, specifically my lungs, were severely allergic to a certain antigen. Now, that could be anything from mold to bird feathers, which in my case, it was bird feathers. We just had parakeets from the pet store, and we had them for a couple of years, and my lungs just started to deteriorate quickly at a certain age. So I was diagnosed at 19, and I was referred to Hopkins at 19 years old, and my doctor, who did an amazing job at keeping me healthy for as long as she possibly could, which is Dr. Danoff. So I was seeing her from when I was 19 years old up until about 25. I seen her up until I was 27, which was when I got the transplant. But I started seeing more of the transplant team after 25. At 25 years old, I was at a lung capacity of 30%. When I got diagnosed at 19, I was at a lung capacity of 60%. So I went down drastically. I had a couple lung collapses, which damaged my lungs severely, and that's when everything started to go downhill really fast. I went from 60% for a long time, and then I went to 30%, and then after my lung collapses and pneumonia, I went to under 20%, and I was referred to the transplant team once I started developing multiple lung collapses. That's where I met Dr. Shaw and Dr. Bush, who took over my care, and they pretty much dove right in and referred me to the lung transplant workup. So I did my lung transplant workup in March of 2019, and they basically said I am good to go, and that whenever I need new lungs, I will be able to get them. So that was March of 2019. I developed my first lung collapses in October of 2018 up until January of 2019. And then they decided to refer me to the transplant evaluation team. So once I was accepted, I was in my junior year of nursing school at that time. And surprisingly, through all of that, I took no time off. Even when I had the lung collapses and I was in and out of the hospital, I took no time off. I was back in school when I could be. My teachers were so understanding and just supportive, and they gave me, the same treatment of everybody else by not letting up on me, but they still were understanding that I was in and out of the hospital for months. So when 2019 came around and I was a junior, I was planning a wedding, and I was going to get married and have my reception in June of 2019, and I had my bridal shower in April, and I had pneumonia, and obviously I had no idea I was feeling any different, because breathing like that to me was just normal for years, and I had no idea. So I ended up back in the hospital after April with pneumonia, and they pretty much told me that they will try their hardest to wait until my wedding was over to start the transplant process. Dr. Bush is one of those one-of-a-kind doctors who takes pride in his patients, takes pride in his practice, and takes pride in his specialty. And that is something that I really took and really learned just from being his patient, how patients want to be treated. And fast forward to June 24th, I got my lungs. I waited. I was in round the clock care. I was getting higher and higher in the list each week. I was dying in my hospital bed, and I just knew that either it was my time or I was going to be blessed with a new set of lungs.